I'm Dr. Hina Kim. Your daily habits quietly shape your energy more than you may realize. Small, steady changes can support your overall well-being over time. Pay attention to how your body responds, and adjust gently as needed. Hello, I'm Dr. Hina Kim, a men's health and wellness specialist. Today, I want to talk with you about something many men in their 50s quietly experience: low energy, slower recovery, and feeling like your body just isn't responding the way it used to. This is a normal part of aging. However, there are simple daily habits that can support your energy levels and help you feel more steady and active throughout the day. Let's go through these step by step in a practical, realistic way. First, I want to start with your morning routine. As we age, the body's natural rhythm, what we call the circadian rhythm, can become less consistent. One helpful habit is getting natural light exposure within the first 30 to 60 minutes after waking up. This helps regulate your internal clock and supports better energy during the day. Even a short walk outside or sitting near sunlight can make a difference. Next, let's talk about hydration. Many men over 50 don't feel thirst as strongly as they did when they were younger. This can lead to mild dehydration, which often shows up as fatigue, low focus, or even headaches. A simple approach is to drink a glass of water in the morning. Continue small amounts throughout the day. Avoid relying only on thirst as a signal. You don't need anything complicated, just consistent hydration. Now, I want to address nutrition, especially your first meal of the day. Instead of starting with high sugar or processed foods, try to include protein, such as eggs, yogurt, or nuts. Healthy fats, like olive oil or avocado. Fiber, vegetables, whole grains. This combination helps maintain stable energy levels and avoid sudden spikes and drops. Another key area is movement. You don't need intense workouts to support energy. In fact, consistency matters more than intensity. Aim for light to moderate physical activity most days. Walking, stretching, or light resistance exercises. Avoiding long periods of sitting without movement. Even short activity breaks during the day can improve circulation and help reduce fatigue. Let's also talk about sleep quality, not just sleep duration. As men age, sleep can become lighter and more interrupted. To support better rest, keep a regular sleep schedule. Limit screen exposure before bedtime. Avoid heavy meals late at night. Sleep plays a major role in how your energy feels the next day. Another often overlooked factor is stress management. Chronic stress can gradually reduce your energy levels over time. You may not always notice it directly, but it affects your body. Simple habits like deep breathing, quiet time without distractions, spending time outdoors, can support a more balanced state throughout the day. Finally, I want to mention something important: consistency over perfection. You don't need to change everything at once. Small, steady habits practiced daily tend to be more effective and sustainable. Your body responds best to regular, predictable routines. As we continue, I'll walk you through how these habits can be combined into a simple daily structure that fits into your lifestyle without feeling overwhelming. And how you can adjust them based on your personal routine, work schedule, and overall health status. Let's begin with structuring your midday energy support. Many men notice a drop in energy during the early afternoon. This is often linked to natural body rhythms, but it can be influenced by how you eat and move during the day. A practical approach is to keep your lunch balanced and moderate in portion size. Including lean protein, vegetables, and a controlled amount of complex carbohydrates can help maintain steady energy. Try to avoid very heavy meals, as they may lead to sluggishness afterward. In addition, consider a brief movement break after meals. A 5 to 10 minute walk can support digestion and help maintain circulation. This is especially helpful if you spend long hours sitting. Even light activity can make a noticeable difference in how you feel through the afternoon. Now let's discuss muscle maintenance, which becomes increasingly important after the age of 50. With time, the body naturally loses muscle mass, a process known as age-related muscle decline. To support your strength and energy, Include light resistance exercises 2 to 3 times per week. Use bodyweight movements, resistance bands, or light weights. Focus on proper form and controlled movement. This type of activity supports mobility, balance, and overall daily function. Another area to pay attention to is blood sugar stability. Fluctuations in blood sugar can lead to periods of low energy, irritability, or difficulty concentrating. To support more stable levels, avoid frequent high-sugar snacks. Combine carbohydrates with protein or healthy fats. Eat at regular, consistent times when possible. These small adjustments can help reduce sudden energy dips. Let's also look at caffeine use, which is very common. While moderate caffeine intake can support alertness, timing and quantity matter. Try to limit caffeine later in the day, especially after mid-afternoon. Avoid relying on multiple high-caffeine drinks. Observe how your body responds to different amounts. This helps protect your sleep quality, which in turn supports next-day energy. Another important habit is posture and breathing. Spending long periods sitting, especially with poor posture, can affect both energy and comfort. You can support your body by sitting upright with proper back support, taking short breaks to stretch, practicing slow, steady breathing. Efficient breathing supports oxygen flow, which plays a role in how energized you feel. Now, I want to touch briefly on mental engagement. Staying mentally active can also influence your sense of energy. Activities such as reading, problem-solving, or learning something new may help maintain focus and cognitive function. It doesn't have to be complex, just consistent and enjoyable. As you move into the later part of the day, your goal should be to gradually prepare your body for rest, rather than staying in a constant high-alert state. This means slowly reducing stimulation, including bright lights and screen exposure, as the evening progresses. In the next part, I'll guide you through how to create a simple evening routine that supports recovery, relaxation, and better sleep quality without requiring major lifestyle changes. And how to make that routine practical and consistent, even if your schedule varies from day to day. Let's begin with evening meal timing and composition. As you get older, your body may respond differently to late or heavy dinners. Eating too close to bedtime can affect digestion and sleep quality. A helpful approach is to finish your main meal at least 2 to 3 hours before sleep. Keep portions moderate. Include lean protein, vegetables, and lighter carbohydrates. This supports more comfortable digestion and allows your body to shift toward rest. Next, consider creating a wind-down period. Your body does not switch from active to restful instantly. It responds better to gradual changes. You can support this transition by lowering lights in your environment, reducing screen exposure from phones or televisions, engaging in calm activities such as reading or light stretching. This helps signal to your body that it's time to prepare for sleep. Let's also talk about temperature and sleep environment. A slightly cooler room is often more supportive of restful sleep. If possible, keep your sleeping area quiet and dark. Use comfortable bedding. Maintain a consistent sleep environment each night. These factors can influence how deeply and consistently you sleep. Another useful habit is evening hydration awareness. While hydration is important throughout the day, consuming large amounts of fluids right before bed may interrupt sleep. Try to stay well hydrated earlier in the day. Reduce fluid intake in the hour before sleep. This can help minimize nighttime awakenings. Now I want to briefly address joint comfort and mobility. Some men notice stiffness in the evening, especially after a full day of activity or prolonged sitting. Gentle stretching or light mobility exercises in the evening can help support flexibility, reduce feelings of tightness, prepare the body for rest. Keep movements slow and controlled without strain. Another important factor is consistency in sleep timing. Going to bed and waking up at similar times each day supports your internal rhythm. Even on weekends, try to keep your schedule within a reasonable range. This helps your body maintain a stable sleep-wake cycle. Let's also consider alcohol and late-night habits. While some individuals use alcohol to relax, it can affect sleep quality and nighttime recovery. Being mindful of timing and quantity may support more restful sleep patterns. As your evening routine becomes more consistent, you may begin to notice gradual improvements in how you feel the next day. Energy is not only about what you do during the day, it is strongly influenced by how well your body recovers at night. In the next section, I'll walk you through how to combine your morning, daytime, and evening habits into a simple daily framework that you can follow consistently without feeling overwhelmed. And how to keep that framework flexible so it works with your daily responsibilities rather than against them. Let's bring everything together into a simple daily structure you can follow and adjust as needed. In the morning, your focus is on activation. This includes waking at a consistent time, getting natural light exposure, hydrating, and having a balanced first meal. These steps help your body shift into an alert and steady state. During the day, your focus shifts to stability and movement. This means spacing your meals in a balanced way, staying lightly active, and avoiding long periods of inactivity. Short walks, posture awareness, and regular hydration all support this phase. By the afternoon, your goal is to maintain energy without overstimulation. Keeping meals moderate, limiting excess caffeine, and taking brief breaks can help prevent energy dips. This is also a good time to check in with your body and adjust your pace if needed. In the evening, the focus becomes gradual recovery. You begin to reduce stimulation, eat lighter meals, and prepare your environment for rest. This supports your body's natural transition towards sleep. At night, your priority is rest and restoration. A consistent sleep schedule, a calm environment, and reduced interruptions all contribute to better recovery. This phase directly affects how you feel the next day. Now, one important point to understand is that energy is influenced by multiple small factors working together. It is rarely one single habit. Instead, it is the combination of sleep, movement, nutrition, hydration, and stress balance. Even small improvements in each area can add up over time. It's also helpful to observe your own patterns. Pay attention to when you feel most alert, when you feel fatigued, and how your habits may be influencing those patterns. This awareness allows you to make gradual, practical adjustments. If you have existing health conditions or are taking medications, it's always appropriate to discuss changes with your healthcare provider. Individual needs can vary, and personalized guidance can help you apply these habits safely. Finally, remember that the goal is not to create a strict routine, but to build a sustainable rhythm that supports your daily life. Your routine should feel manageable and realistic. Consistency over time is what supports long-term energy and overall well-being. In the next part, we can look more closely at how specific lifestyle patterns, such as meal timing, activity levels, and sleep habits, interact with each other, and how small adjustments in one area can positively influence the others. And how understanding these interactions can help you make more informed and effective daily choices. Let's start with the relationship between meal timing and energy patterns. Your body responds not only to what you eat, but also when you eat. Irregular eating schedules can sometimes lead to uneven energy levels throughout the day. Keeping meals at relatively consistent times may help your body maintain a more predictable rhythm. Spacing meals evenly can also support better digestion and reduce sudden drops in energy. Next, consider how physical activity and sleep quality influence each other. Regular movement during the day often supports deeper and more stable sleep at night. At the same time, better sleep can improve your ability to stay active and engaged the following day. This creates a supportive cycle between movement and rest. Another connection to be aware of is between hydration and mental clarity. Even mild dehydration can affect focus and alertness. Maintaining steady fluid intake throughout the day helps support both physical and cognitive function. This becomes increasingly important as natural thirst signals may change with age. Let's also look at stress levels and physical energy. When your body is under ongoing stress, it may stay in a more alert state for longer periods. Over time, this can feel like reduced energy or increased fatigue. Simple daily practices that promote relaxation can help balance this response and support more stable energy. There is also a connection between muscle health and metabolism. Maintaining muscle through regular activity supports how your body uses energy. This can influence how steady or variable your energy feels during daily tasks. Even light resistance exercises can contribute to this balance over time. Another area to consider is consistency in daily habits. Frequent changes in sleep timing, meal patterns, or activity levels can make it harder for your body to maintain stability. A consistent routine, even if simple, allows your body to adapt and function more efficiently. It's also useful to recognize the role of environmental factors. Lighting, noise levels, and screen exposure can all influence your alertness during the day and your ability to relax at night. Making small adjustments to your surroundings can support both energy and recovery. As you begin to see how these elements connect, the goal is not to manage each one perfectly, but to create alignment between them. When your habits work together, your body doesn't have to constantly adjust, and this can support a more steady sense of energy. In the next section, I'll guide you through how to gradually implement these adjustments in a step-by-step way, so you can build these habits at a pace that feels manageable and sustainable for your lifestyle. To conclude, I'm Dr. Hina Kim, men's health and wellness specialist. What I want you to take away is simple and practical. Your energy after 50 is influenced by everyday habits, not sudden changes. Small, consistent actions in sleep, nutrition, movement, hydration, and stress balance all work together to support how you feel on a daily basis. There is no need for extreme adjustments. There is also no need for perfection. The goal is steady improvement that fits realistically into your life. If you focus on building routine, paying attention to your body's signals, and making gradual adjustments over time, you give your body a better foundation to function at its best for your age group. Always consider your individual health situation and consult a healthcare professional when needed for personalized guidance. I appreciate your time today, and I encourage you to continue learning and applying these simple, evidence-based lifestyle habits as part of your ongoing health journey.